The second one was what?
The second one was an ushering company that I started in Kigali in 2014.
You started it after the other one failing?
No, it was still operating.
Okay, cool.
So when I came here, actually 2015 is when I opened it officially. It was called My Usher.
You usher.
My Usher was the name of the company. So I started it in Kigali and I went back to do school in Uganda. And it was running for up until COVID. That it was buried because, I wasn't around to manage it well.
The challenges in COVID were many,
Exactly. So some of us didn't have the right.
Hello there. Thank you so much once again for joining us at the Voices podcast. My name is Arafat. Today we're joined by, a friend of mine and CEO, founder of ECURIS Health. It is a startup company in Kigali here. They operate from Noriskin. Today, he joins us to actually discuss on ECURIS Health. It is ECURIS. He will help me describe more about that. And he joins us today to discuss about having a startup company in Kigali and also looking at what it is to start a startup company in Kigali and to operate in Rwanda. And of course, we will discuss more on the challenges they're likely to be facing in startup companies or in owning up a startup company in Kigali, and also how they envision the future with these new companies coming in Kigali. My brother, how are you?
I'm okay. Thank you, Arafat, for having me.
It's a pleasure to have you today, brother.
More than a pleasure on my end.
So, how is life so far?
Life is amazing. I'm enjoying Kigali.
You're enjoying Kigali?
Very well.
When you say you're enjoying Kigali, it seems you're not from here.
Yeah, I just landed 3 months ago, to be specific.
Really?
3 good months ago.
3 months ago?
Sure.
From?
I was living in Uganda for close to 30 years, I must say.
30 years?
Yeah.
My goodness. You from Uganda?
Perfectly, I would say that because I was born and raised there. But every other time I wanted to come home, that whole... that whole thing of I want to be home. And the fact that I'm called Kagame, it made me have that curiosity. Like, what is in Rwanda?
What is in Rwanda?
What is in Rwanda?
I hear about that
Rwanda?
man.
Yes.
I hear about Mr. Kagame.
Exactly.
Who is that president? So that also pushed you to come?
That pushed me to come.
Really?
I've been coming occasionally, but I'm here to stay. So,
wow. That's wonderful.
I'm home.
So,
Happy
my brother,
to be home.
to someone who does not really understand who is Mr. Kagame, what would you tell that person?
Stephen Kagame is a young, ambitious visionary. I like to call myself the fourth man. That is something I'll maybe have a discussion about.
The fourth man.
The fourth man. I'm very passionate about customer experience. I'm in the business of moving hearts, so I love to speak to people. I love to build things that will last for generations.
Wow.
Because I noticed that's like the one thing we are lacking in Africa. I love Africa. Africa is the one country, is the one continent that really makes me have moments where I can't sleep because I see a lot of things are off course. So I love Africa as a continent. So Kagame is a founder and CEO of a health tech that started 4 years ago, to be specific. And the inspiration to start that health tech was basically to improve the quality of healthcare that we find ourselves in.
Started from Uganda or here?
That was in Uganda, Kampala, during COVID, to be specific.
Oh, wow.
So that's basically who I am. I started like 3 companies before even coming here. So you can imagine the entrepreneurial spirit has been there for years.
So you've started 4 companies failing.
4 companies failing.
If I say 4 companies failing, is that okay?
That's okay because I believe in trying out things. I'm a risk taker. My first company was a crafts company. I was selling shoes.
Oh, wow.
That was during my first year of campus.
Selling shoes?
Craft
Were you
shoes.
making them for yourself?
Someone was making them, but because I know how to sell, I realized that I could actually make money off that. And the one thing that I wanted to sell was African pieces. So I found myself selling African crafted shoes.
The second one was what?
The second one was an ushering company that I started in Kigali in 2014.
You started it after the other one failing?
No, it was still operating.
Okay, cool.
So when I came here, actually 2015 is when I opened it officially. It was called My Asha.
You usher.
My Asha was the name of the company. So I started it in Kigali and I went back to do school in Uganda. And it was running for up until COVID. That it was buried because, I wasn't around to manage it well.
The challenges in COVID were many,
Exactly. So some of us didn't have the right guards for us to avoid that.
To speak about you generally, the real entrepreneurs they talk about.
Exactly.
You have that passion of entrepreneurship and, you envision yourself as one of the best entrepreneurs to be, looked at in the future.
Exactly. That's why I say myself, because I love to do things. My mind is free. I'm not in a box. So I try to allow myself innovate and evolve as an individual.
You've talked about ECURIS. Can you, describe to us what actually ECURIS is and what is made up of ECURIS? How does it work? Why did you have it?
So ECURIS,
what had you really noticed that was going wrong that you wanted to solve?
So just to give you a bit of background to my career, I trained as a technical pharmacist with an associate degree in pharmacy. And then that took me into a hospital setting. So I worked for a hospital in Kampala, private hospital, that I may not be at liberty to share here, but it's a hospital that kind of built my foundation into ECURIS, like you see it. So I worked in the pharmacy department for 3 good years. That was from 2018 to 2020. So during COVID, because of my love for customer experience, I noticed that a lot of things were out of place. Hospitals have categories of patients. And some of those patients, you have the acute patients, those that have cough. I got a malaria, then you go to the hospital to see a doctor. And then there are those that actually have non-communicable diseases, like the hypertension, the diabetes, tuberculosis. You have cancer, things that really take long to treat, to heal.
And so, some don't heal even.
Some don't. So those are the repeat clients of any private hospital because they come back every month to get their medicine refills. So being at the tail end of the healthcare value chain, I noticed that most of these patients would come back every month and we didn't have a relationship with them. But they were swallowing medicine. Me as someone behind giving them medicine, I noticed that I give them medicine, I tell them you're going to swallow the medicine this way, and that way. But I don't tend to follow up to know whether they swallowed the medicine in the way that I instructed them to swallow that medicine. So I noticed that we had, out of 10 patients that had been admitted in the hospital and then discharged, 3 would be readmitted in a space of 2 to 3 months. That became a very big challenge. So I was like, how can we solve this? Why is it that we are treating people and they are coming back again? What is it that we are not doing right? The hospital I was working for had arguably the best doctors in the country, if not in the region. But when the patient left the brick and mortar system of a hospital, we didn't know what happened after that. Up until they came back to get their treatment, their monthly refills, and maybe to do reviews with the doctor. So that, in a way, made me feel like there's a gap. Now, just to make you understand, I was planning to quit healthcare because COVID got me to think about my next 10 years. And I was like, 2030, where will I be?
But why?
Why? Because I'm the kind of person who hates monotony. I hate doing the same thing every day for 365 days a year. When I do something for 3 good years and I realize that I've become automated, it breaks me. It's draining. So I started to think of how do I quit healthcare? Because it was depressing in its own way. During COVID, we were literally staying within the hospital. You couldn't move out because of the pandemic. So I was like, is this the life I want to live for the next 10 years? But then in that very moment, I realized but there are patients that are dying. What is it that you can do, Kagame, to make sure these patients actually can be sustained for some good years? And then I thought of the role of a pharmacist in the healthcare value chain. Most of these patients spend some time with the doctors in the doctor's room. They go to the lab. After getting the results, they go back to the doctor. After that, they come to the pharmacist to get medicine. So the pharmacist just gives them medicine and they leave. The last person they see in the hospital is the pharmacist. So I was like, that means this guy could actually be the game changer. The pharmacist can be the go-between the doctors and the patients. Because this patient sees the pharmacist last in their journey of getting healthcare. And the pharmacist is a custodian of drugs. They know what every drug is about. And this person is going to swallow those drugs. That means they can be my friend. So I noticed that many patients were starting to have mental health related cases. And that was because it's a very painful journey to swallow medicine every day of your life. If you've spoken to...
Especially for those having chronic diseases.
Chronic conditions. Those are the ones I'm talking about. So I was like, Kagame, what can we do to make this journey very seamless? So something came to my mind. Delivery. I believe in intuition as an individual. So when that word came to me, it's like, what is it that we are going to help to deliver to these patients? And because as in the drugs sector, I realized I'm going to deliver medicine to them. So I sit down, I'm like, how do we do that at scale? Because we literally have 100 to 200 patients coming to the hospital every day. How can we make that process consistent and repeatable? So because I wasn't...
So that you close the gap of missing drugs.
You
close the gap of giving them the right way of, swallowing or taking these drugs.
Yes.
That was also key among the things you wanted to solve.
Exactly. And also the lonely journey of swallowing medicine. We are human beings. And I always tell people that we can feel after each other. Like I'm talking to you right now, there's some energy that I'm emanating as you're listening to me. So a patient is a vulnerable person when they come to the hospital. So as a healthcare professional, I was like, how do I
want to give them the motivation?
I wanted to give them that. The experience. I felt like that's what they needed. Beyond the technical knowledge of swallow the medicine this way. I wanted them to know that on the journey you're on,
there's someone together. There's someone who is with you.
There's someone to walk that journey with you, and that person was the pharmacist.
How?
So, currently, the problem we have, and I think you know it in Africa, the doctor-patient ratio is very big.
Very.
One doctor, 10,000 patients.
Very, very big.
So, how do you even bridge that gap if you're not going to leverage technology?
That will take hundreds
of years. So the infrastructure problem we are having, the people that are dying every day because of cardiovascular related conditions, they are not dying because they are not taking medicine. They are dying because they are neglected. Because the journey they are on is a lonely journey. You can't think of swallowing 5 types of medicine every day of your life. Because if I have diabetes, I have hypertension. And maybe I have a mental health condition. So mixing all those things and putting them through your mouth could have an effect on you as an individual. It's a lonely journey. And many people are lonely. People are depressed out there. They are swallowing these medicines. They're driving very beautiful cars. But it's a very depressing journey. So ECURIS, for me, came as a solution to that. My inspiration was basically to build an ecosystem, digital, to bridge that gap, to make it seamless for both the primary doctor and the patient. Because the doctors are in limited quantity, but the patients are increasing every other day. So to optimize the healthcare value chain, where you have a doctor, a pharmacist in between, and a patient, the patient doesn't understand our technical jargon.
Some terms are not even easy to understand.
So the pharmacist is supposed to make it easy for the patient. Part of the things that we learn is patient counseling. But man, the average time you have with a patient at the tail end of the healthcare value chain is literally 5 to 10 minutes. So how much can you do in that period to make a patient feel a certain way?
I was actually, you've reminded me, there's a time I visited one of the biggest hospitals in Kigali.
Yeah.
And I was pissed. But at the end, I realized that I didn't think about it. Because I was supposed to be at the consultation room of that doctor at 11 a.m. in the morning. And I reached 11:30. So they refused me to enter the consultation room. They were like, "You're late. You've come late. You can't enter." And I was like, "Come on, it's 30 minutes."
Yeah.
But the doctor told me it is 30 minutes, but there's someone else who's supposed to enter here 12 midday. So if I welcome you here, that means this person also have to come maybe 12:30. So we'll also be entering into someone else's appointment.
Yeah.
So if I continue like that, there's someone at the end who I will not treat, because I'll be leaving this room for someone else to use it, another doctor to take over. And that person who might miss out might be the one who needs me than you.
Yeah.
You didn't come on time. I'm sure 100% you don't need me so much. And I was like, but it was the truth, bro.
Yeah.
Come on. If you're really suffering and you need this treatment, you can't be late.
You'd be there 10:30.
You can't be late. You would be there 10:30. That is the truth of life,
That's
bro.
it.
So you've brought that, and really I've thought about how patients have limited time with doctors. Limited time. Just imagine you spend only 30 minutes with a doctor and you have to explain, you give the background of your disease, you talk about which places you visited, for treatment.
Yeah.
You talk about how it caught you. You talk about everything. And this guy is listening and is supposed to come up with a final analysis of your disease and then decides which description to give you. You can hear how difficult this is.
In those 30 minutes.
In those 30 minutes.
And not everyone has 30 minutes, by the way.
And not everyone has 30 minutes. Yes, there are those who might have maybe more minutes just because of some diagnosis going on and all that. But you've brought me to an understanding of how it's limited to speak to a doctor. And at the end, you just go pick drugs. So, my question is, how are you doing this? Or how are you envisioning to ensure that the role of a pharmacist is fully played as in this circle of patient, doctor, and then pharmacist, and then back home for drugs?
Yeah. Thank you, Arafat. Your experience is really fond. I have also noticed that in hospitals, having been in the private healthcare sector, and now this would be like the ideal, system that everyone would want to, get care from. But to notice that there are also gaps in that setting shows you how much of a burden it is on our systems. So, coming to your question of how are we envisioning to bridge that gap? So, ECURIS, firstly, when I thought of creating an enabling environment to have that actualized, I felt like not everyone understands how to use a system or an app. But the fact that I was in a hospital setting where a majority of the patients that were patronizing that hospital were college
a bit
educated.
of a certain standard.
They were educated. Basically, middle class, upper middle class. That's the segment. So majority of those can try to play around with their smartphone.
Yeah.
So I was like, I don't want to just go the direction of, it's the buzzwords about tech, having an app, having, AI related Internet of Things. Now, Africa and where we are right now, based on the infrastructure that we are working under, certain things are not yet feasible for us.
Definitely.
So even when we're coming up with a way to solve this, we were thinking about the layman, that mother, that father, who did have as much exposure as you have, that might not be able to use that app.
Yeah. They don't even have access to the internet.
They don't have access to internet.
And even these phones you're talking about, how many do have smartphones?
How many do have smartphones?
Even the small phones. Some people in the villages don't have small phones. They have to go to maybe to the neighbor still.
So you can imagine. So we're like, can we create an offline system just to as our prototype? So I got pharmacists on the team. I got, software developers on the team to simply put this idea on paper. Because I was coming from a pharmacy perspective, I wanted the pharmacist to play the biggest role. Because these patients are going to come back for that drug that you know how to explain.
You actually can give it to them before even they come back.
Exactly. So we're like, how do I have, because you cannot have any decision made without data. So we're like, we have the data. The hospital I was working for had all the data, and it had given me a platform to actually test this system. So we firstly started with an Excel. Can we have all the patients that are taking medicines every month? And we noticed 60% of the revenue the hospital was making was coming from those patients, the repeat clients, the chronic patients. So I was like, for us to have a sustainable system, we're going to have to build it around our repeat clients because they bring in the money. We are paid because of them. The ones who come with, acute conditions, cough, I got a burn, that one's it's going to come once in a blue moon. So I was like, let's create a database. So we populated it with patients. A single customer view where you have the patient's name, basically their biodata, and then you have the conditions that they're struggling with, the treatment they're getting, their doctor. So, meaning as a pharmacist, you own the patient. The patient is not someone you know by name, but you know the conditions that they're dealing with. And because healthcare is built on confidentiality and privacy, you are trusted enough not to share that information with anyone.
I understand privacy, but confidentiality is like, what are you trying to mean with the hospital, with the pharmacist and the patient?
So confidentiality is whatever it is that you have, any engagement you have with a patient that involves their information.
Remains between?
It remains between you and the patient. And that's part of professionalism. Our ethics in the medical perspective is basically to make sure that that information is kept. So I was like, when we go online, how are we going to do that? And then my tech guys were like, yeah, we could have an end-to-end encryption and set particular security measures to make sure that that information is not duplicated or hacked into. Because part of the patients who are receiving were high-profile clients. These are people that have a lot of things to protect, especially when it comes to reputation.
And to health, no one wants their health to be
No one
out.
wants their health to be out there. It's a sensitive thing. So like, how do we make it possible? So we created that through the system. So it was created based on the patient. I love to say that there is no system you're going to create from your perspective
Without involving the final
user.
Much
of the time, because we're excited, we come up with beautiful apps that actually do not solve the problem. Because the one going to use it,
you've not involved him.
You've not involved them. So because I was in a hospital setting, I had back and forth engagement with these patients. How would you want this to play out? what features would you want? And it was on a rolling basis. And then we were able to develop a system. But that came after understanding the pain points of the patients. Like I gave you my background story. We realized that many patients forget to swallow their medicine.
They do forget, and some even get fed up of the medicine.
Even myself, I don't like swallowing medicine.
Yeah, people get fed up of that and say, if I had someone pushing me, perhaps I would
probably swallow. You give me medicine for 1 week, bro, I'll swallow for 3-4 days and I'll be done. But the goal is that you have to finish the medicine, because when you don't, if it's a bacterial infection, you're setting yourself up for bacterial resistance, antibiotic resistance. And then at the end of the day, you're going to struggle to use the same drug that you swallowed, because the body is now used to it. The bacteria got...
And actually, by that time, it can't work. You know that there's that problem now globally. It's called, is it drug resistance kind of? I don't know. So now you studied that and you accepted that. How are you now protecting? You are coming to that. How are you protecting these people that really trust you with their information, share it with the pharmacist? How are you doing that?
So one way of doing that is, like I told you, that we put measures, and from a technical perspective, there were systems put in place, softwares to protect that information, and part of them was, using the encryption kind of setting.
Are patients catered of to have their consent considered?
Yes, that's the approach we used. Where even the tagline for ECURIS is "Own Your Health." Actually, I think I hadn't told you about that.
Yes, own your health.
Own your health. That means that the patient has complete participation in whatever we are doing with their health. So the patient has the power to say, I need my information. And they have the power to have ownership of that information.
Let's be real. Let's put it in real life. Let's assume X is suffering from diabetes.
Yeah.
And is maybe coming to your hospital. He's coming to one of your hospitals to pick drugs. How would you handle this person, this patient, from the first day they come to the hospital, and then to the following days they will be coming to pick the drugs? How is that journey, managed? From who to who to who, and then at the end?
Yes. So I like it that you brought in that example. So there are two cases in this. We have a first-timer coming to the hospital, and we have someone who has been coming. So I'll start with the first-timer. If you come and you're a non-diabetic patient, that means you've been managing it from a particular facility, be it a government hospital, be it a private institution. So when you come, what the doctor will ask you for, actually when you get to the reception, they have to register in the system. That's step one. So that means they're going to ask you your names, your next of kin, basically your biodata. And then after you enter, they will ask you, which doctor have you come to see? Most of the people that work at the front desk are always trained to understand which doctor to refer a patient to based on what they are presenting as symptoms. So some don't require a specialist. They just require a general practitioner. So when this person gives you a history, you know what, I'm a diabetic patient, I've been getting treatment here and there, but I want to switch to this hospital. So in that particular case, the different doctors to refer them to. So in this particular case, you refer them to, could be a physician. They go to the physician, but before that, they go to the triage room. If they're an insurance patient, you've already cleared them in the system. If they're a cash patient, they have actually paid. So now that's like the mundane system, the traditional system. You get in, you're registered, go to triage, see a nurse. The nurse takes your vitals. After that, go to the doctor's waiting area. If at all you're going to, the doctor has a line.
In the consultation room.
The consultation room. You see the doctor assesses you. After assessing you, of course, he's going to look at your history. You come with some papers, maybe your previous drugs you're swallowing. Yeah, but the focus is for the chronic patients, non-communicable kind of conditions. So that's our focus mainly. So empowering them with the right tools can help us serve that underserved market of people that are not able to access internet, people that can't use these tools. So that could be another person to help us bridge that gap. the community health workers.
I mean, the can you walk us through the user journey? I mean, how are you doing the online requests or online prescription? Are you planning also to have online prescription of the drugs, or maybe doctors taking care of patients,
Yes.
maybe with visual conversations or consultation online? How are you planning to do this?
Yes, that's a good one. So, like I told you, the inspiration to start ECURIS came during a time where
COVID was raging.
People were dying. And at that time, I think mobility was the hardest thing to do. So we came up with a system where someone could actually have a teleconferencing kind of call, like a video conferencing call with a doctor. But you see, in healthcare, there's so much you can do with that. There's not so much you can do with that, because healthcare is personalized. If you have a skin problem, probably you could just take a picture, but maybe your camera might not be the best to give me the real texture of your skin. So that might require me to actually have you come to the hospital. So ECURIS was built around, okay, yes, in the event where it's inevitable. I'm in the UK, and my primary doctor is in Kigali. So we can actually set a time to have a teleconferencing or teleconsultation, maybe at 6 p.m. Have the call. So teleconsultation is for minor cases and cases that can be managed remotely. But if at all a case requires me to come to the hospital, because there's such a thing as physical examination when a doctor is assessing a patient. So however much we have all these technology-enabled systems, we're not going to run away from that place.
The traditional way of handling patients is not going to run away.
Yeah, there's a personal touch that is going to remain. Like I said earlier, healthcare is 51% emotional. The 49% is a technical. So if you come to my office, how I touch you, how I speak to you, that's why doctors have got to have empathy. That could have something to do with how you're going to leave the hospital. That before you swallow my medicine, there's a way you're feeling already.
Yeah.
So teleconsultation is basically for convenience. In the event I'm unable to actually come to the hospital, I'm in maybe up country, I went for work, and I need to ask the doctor something, like what a rush, I'm feeling a headache. Can we have a teleconsultation?
Minor issues.
Exactly. We are going to be able to schedule that call for you. It is scheduled because doctors are busy. I'll be honest with you. ECURIS came in because we realized that in this healthcare value chain, a doctor is a hard-to-find person. Doctors are very busy. So the pharmacist is supposed to be able to support. It could be the pharmacist, could be the nurse. That's why we have nursing care as well under the same ecosystem. That a nurse is able to offer care under the guidance of a doctor by going to the home of the patient. Because chronic patients are literally at home. Some of them are retired. And maybe their kids are outside the country. Maybe they're probably having a maid supporting them, or maybe a daughter. So we have provided for a nurse going to their home and taking care of them from the comfort of their home. But of course, within the guidelines of healthcare. Because
of that particular country where you're operating
exactly. So that is part of the story. So you said about teleconferencing, that is something we do. Online pharmacies. So when a hospital is plugged into the system, their pharmacy is plugged into the system. So if a doctor prescribes, because we are trying to reduce on the carbon footprint, at the end of the day, the environment is going to be very important for us. So ECURIS is built on a system that is sustainable in a way that it takes care of the planet, takes care of the people, which is the patients, and it takes care of the people, which is the doctors. It also takes care of the profits, because at the end of the day, you need money to be able to run.
Yes, to keep running.
So that's basically the system. So we make sure in whatever intervention we are doing, we are thinking about all those three facets: the people, the planet, and the profits. So basically for the tele-related healthcare, it's basically for convenience. In the event you're unable to come and see me as a doctor. For example, pharmacy. You're coming back for a refill in the pharmacy.
No, let's say like there's something you hit on, and let's say a doctor maybe I've called a doctor, I'm far from Kigali, and
Yeah.
I've got a rash on
Yeah.
my hand, and then I feel like, let me show the doctor.
Yeah.
I want to talk to the doctor who can prescribe me maybe a tube to use to maybe
Yes.
survive those days down there.
Yes. The doctor prescribes on the system. Says, get this tube.
Prescribes that on the system
Yes.
and tells you where to go find it.
Where to go find it.
How do maybe pharmacists know that this drug was actually prescribed by this specific doctor? Because we need to have a stamp of a doctor.
A stamp, yes.
A doctor has to stamp on, let's say, maybe if you're telling me that this will be only for private people who can afford, private patients who can afford just to go and purchase it on their own.
Yes.
But of course, if you know how the insurance companies are operating, not here even only, even in other parts
Everywhere,
of the world,
yes.
they need that stamp
Yes.
to prove
That's for sure.
to prove their treatment. That this is this doctor, this is this.
Yes.
How are you planning to do that? Because that's really kind to me, rigorous and difficult for you.
So there is such a thing as system-generated prescriptions that are by law and regulations allowed currently because of the era we are in. So every system-generated prescription has an e-signature of the doctor. If that does not come along with the prescription, that prescription is regarded invalid. So I would think that you're self-medicating.
Okay, cool.
So that's basically what we
that's
incorporated
really
into the
nice.
system.
So
Yes.
you mean this doctor can still even help you to assess drugs, to tell you which hospital, which pharmacy online that has these drugs, so you can just buy it online.
Yeah.
And then they find someone to deliver it to you where you are.
So the beauty about our platform is you will have like 30 pharmacies plugged into the system. So the patient has a lot of options to pick from. So if I'm a patient and I'm in Rusizi and I see pharmacy Y, pharmacy X, pharmacy, they're all on the platform. Once the doctor drops the prescription, if that hospital doesn't have that drug, eventually you will see a notification from a pharmacy that has that drug. And that's bridging the gap you were telling me about.
Wow.
Of having to look to hope pharmacy.
It will be kind of AI powered.
Exactly.
Where you can, if the AI detects that you're searching for a certain drug because you write that drug there.
Yes.
It will immediately show you which hospital that which pharmacy that has that drug.
Has it, yes.
Or it will immediately bring the drug down, and then under the drug it can show you which pharmacy has it.
Exactly.
Oh, that's
and
wonderful.
The pharmacy will get the notification, pack the drug, deliver it to your destination.
That's really wonderful. That's wonderful. So, I mean, there's so many people suffering from mental health.
Yes.
Mental health is a very, very big problem. Some people are calling it a pandemic.
Yes.
And I'm wondering that this is something you should also take on. Are you planning to have mental health professionals, apart from the, non-communicable diseases professionals that you really bring on board first? How are you planning to have this put in place also?
That's a very important one. So mental health is a very big problem. They normally say that 1 in 3 Africans will at some point suffer mental health, but we don't actually believe
1
that.
in 3 Africans?
1 in 3 Africans.
Are they really serious?
Yeah, 1 in 3. But I feel like 1 in 3 is not even, it may not be representative of the actual figures. But trust me, it's like you said, it's a pandemic. So currently, when you look at our system, the fact that it's built on a privacy kind of structure, most people, for them to have a safe environment to share what they're dealing with, they will need to actually be assured of privacy. Because, people are going through a lot out there. I've worked in a hospital before. I've seen very rich people break down. But yet they're the people we look up to. I've seen them like firsthand, like some have died before me. Very rich people. And that's why ECURIS came, because we noticed that this journey is a solo journey and it's the hardest journey. So we have a team of mental health professionals in the back end that will also be registered on the platform. And for conversation that require you to remain anonymous.
So that you can open up.
Exactly. and the plan is basically to apply the we call it the EPS. It's a system that allows for privacy. Like, it's encrypted. The conversation you're having is a video conversation. It's encrypted. So meaning, I, as a doctor, I cannot share it with anyone. Once it's
done,
it's done.
it's done. You can't
You can't even refer to it. Like, it's done. So basically, because people fear to have their information out there, and that's why many people are fearing to adopt and uptake these things, the tools that are coming, AI and what. People are scared. They're like, I'm literally going to be naked before everyone, because the systems actually undress us. Bro, Google has all your data, all your search history.
Absolutely.
Whatever it is that you search, Google has it.
Yes.
So the day things spill, you'll be out there. So that's the fear everyone has, and especially in Africa.
Seriously, how are you trying to assure people and implanting that into people that ECURIS is a game changer?
Yes.
Because these things have happened on different platforms, and people, and even the big platforms we use, people's information is being shared.
It's being shared
and sold.
Yes.
A lot of dollars.
That's a lot. So we've tried to align our development and whatever it is that we're doing to the HIPAA law. HIPAA it's supposed to be it's a regulatory body that monitors what is done with patient information, and then the GDPR, which is enacted from the European Union. So all these are the standards that are in place to make sure that the patient's privacy is at the center of our care. Because, like you said earlier, many doctors go to school, but they go to school not knowing that they're going there for the one person they're going to treat. So if I get to the hospital and I treat this person the wrong way, that means that means the purpose of my going to school is nothing.
It's usually not about the number mostly. For me, it's not about the number of people you take care of.
Exactly.
For me, it's more of how would you take care of the one you meet.
The one you meet. So
are you proud of what the handling? Are you proud of the way you handle people? That you should be handled the same way.
So that's a challenge.
You see? So about regulatory, how are you planning? How are you like? What are some of the challenges that are you currently facing and you want to be worked on, or to have your ECURIS streamed out and working well as you want, that you think really blocking you or somehow can be resolved?
Yes. So I like it that you brought that up, because why I came to from Uganda to Rwanda is basically because Rwanda has built an ecosystem that is very convivial, very supportive for any health tech startup. The policies in place are encouraging the digital evolution. So government buy-in for me in this country has made it even easier already. We're already having discussions with Ministry of Health to test our system before it's rolled out. Their partners, we've already reached out to test it. Because right now the government is also on, like you said, there's already a plan to actually have a system that centralizes all data where you can share. If I went to hospital X, I can share my information to hospital Y.
Yeah.
In that there's consistency. So the regulatory bodies here are very supportive, and I must commend the government for that. They have allowed startups like ours to easily pivot, to easily refine our ideas in a very supportive environment. Currently, we are part of the Health Tech Hub Africa at Noskin. They gave us space to operate. And that's kudos to the government for actually creating such hubs, accelerator programs, to make sure whatever we are building has the best springboard for it to actually go up. Because much of the time, most of the startups are stifled by the policies around.
The policies.
Around
and
healthcare.
failure to have professionals who can help them shape their ideas into fine-tune them to the level where they can really be launched when they are coming to have an impact.
Yes.
You know, some people have launched ideas and have failed because they were launched before they matured.
Exactly.
Before they have the actual idea well-tuned.
Exactly.
So when are you planning to have this out?
So we are looking at by end of August, we need to have the system up and running in some hospitals here. We have reached out to some already, and they are already giving us open arms for us to be able to have the tool tested with them. So once that is actualized and we've debugged most of the things in the system and aligned it to the needs of the patients here, I think we'll be up and running.
I mean, I'm wondering, do you have some impact already registered about this ECURIS, where you've operated from, maybe in Uganda or...
Yeah, so in Uganda, yes, at the hospital I was working for, I mean, by just having a tool where chronic patients could be taken care of, we saw a 30% retainability. In other words, the retention rate increased by 30% in just 2 years.
Wow, that's wonderful.
So meaning if I was seeing 30 or maybe 100 chronic patients,
30 came back.
30 came back.
And through the system?
Through that, because we cared for them so well, they continued coming. And that has actually been the case all through.
If it's not a secret,
yeah,
how are you securing finances? Or how would you ask someone to finance you?
Yeah.
Or is there a way of, are you welcoming people in maybe who are in venture capital that would wish to invest in you or something like that?
Yes. Wow, that's it's not a secret, because I'll be happy for any partnership. I believe our kind of ecosystem is not an ecosystem where you can operate as an individual. Yeah. If you're going to go far, you can't go alone. So I'm open to venture capitalists. We need funding, because most of these things, the fact that we have AI coming in and most of it, we need to actually optimize and keep refining this system to be able to meet the current trends and demands of the consumers that we are trying to target. So we need venture capitalists. We had an opportunity of pitching it, and this I must share with you. And that was in 2021. We pitched it, and we secured seed capital from UNDP. And kudos to UNDP for giving us seed capital, $5,000. That was our first seed capital.
That was good money,
bro. That was good for the start. In fact,
before you even launched the idea,
we simply pitched it and told them this is exactly what we want to do, and they realized that this idea was feasible and nascent to be put on the market, and they trusted us with their funds. And out of that, we've been able to actually have a minimum viable product that can be tested on the market. So we are in a phase where we are leveraging that kind of funding to even have a product to test in the market. So I must say, of course, there was a lot of bootstrapping that I must be honest with you. I literally had to live on a bare minimum to be able to fund this whole thing, having to do an 8-to-5 job, and then to live, just to live through life. You don't have the liberty to do most of these things. So most of the money was channeled to developing the system. So to be honest, because I believe in the idea, I believe in how much it can do to make the lives of patients better. I was happy to lose or to actually invest all whatever I had to make sure it would get to the level it is right now. Of course, with the support of a team of people that I'm working with, it was able to get where it is. So we need funding. We need funding. And I'll repeat that, we need funding to be able to scale. Because right now we are in Rwanda to basically have a proof of concept. Rwanda has systems in place to actually have an idea tested and proven to be able to scale into other markets. And that's what I commend the government for. They have created an ecosystem that makes startups to actually thrive to a place where they can compete globally. So that's basically the plan. We are finding ways of having these solutions scaled into different facilities, and once the facilities have made good use of it, then we can make that as a case in other markets, and basically that will help us to have the bigger impact, because the mind is to improve the healthcare of Africa, to make sure that every chronic patient could live probably an extra 20 years or 5 years or 10 years to what they are living right now.
Or even the time they are remaining with, they live it happily.
Happily. It's a lonely journey. Very lonely. There are people that have lost the motivation to even grow their careers because of the fact that they have to swallow medicine the rest of their life. I'll give you an example of an HIV patient. Just hearing that causes stigma. So imagine that person is living that journey alone. If we were supposed to live up to 100 years, they probably will die off at 50. Because,
Overthinking.
yeah, that's where mental health cases are coming from. It's a lonely journey. Imagine you're not sick, but you're having mental health related cases.
Okay. If you can tell me as we conclude, how, I mean, maybe you're not going to say this.
Yeah.
How will hospitals be paying, and how will someone be paying to access the site?
Yes.
As a single person,
Yes.
as a single patient, an individual patient.
Yes. Yes. So how we are exchanging value for what we are offering is basically, one, revenue sharing is one of the models that we are working with. That if at all you have 30 patients using the system to access a particular service, if each patient is giving $100,
Give us 15.
you're going to give us 20% of that. Because the system is enabling you to actually have a seamless engagement with that patient. So that's the model we are using for now. And of course, the stipend that someone has to pay for being on the platform, that's the one-off that you pay every year. It's actually an annual renewal. Like if I'm a pharmacy and I'm plugged into the system.
So simply, the system is more impacting the owners of the hospitals,
Yes.
or more than the patients.
It's helping them.
Because at the end, unless the hospitals will increase the price,
Yeah.
the cost, maybe.
Yes.
But if the cost remains the same and they pay the 20%, I mean, the patient is benefiting from it because it will be paying one off payment for a whole year.
Yes.
And can access all these experts.
Yeah.
So, are you not scared that the hospitals will actually hike the prices because patients are accessing your site through?
No, not really. Actually, the goal and the mind that the engagement, the partnerships we're having with the hospitals is basically to make it easy for the patient. Because I talked about quality, accessibility, and affordability. So if you're going through the platform, it's not going to be the same as going through the brick and mortar system of having to drive to the hospital to pay that fuel. You're already actually having an effect on the environment. So what we are doing to basically give you value is to make sure the patient at the end of the day, if there's a pain point they had in their healthcare cost, has it gone down by a particular percentage? That will be the metric for us. That if I've been spending 100,000 on healthcare this year,
how much have I spent so far since I joined the app?
Exactly.
Oh, wow.
That would be a very important metric for us to measure.
So, my last question.
Yes.
Looking at Rwanda's healthcare system.
Yes.
And of course, looking at where you come from.
Yes.
What is it that is now haunting you down in Rwanda that you really seek to see resolved through this system? Looking in particular at Rwanda.
Yes. Yeah. Wow. Rwanda is a developing economy. I must be honest with you, Arafat. It's a developing economy, but because it has systems in place, I feel like it has put itself at a pedestal where things are going to start to align. The only challenge that I feel like the government might want to address is the quality of healthcare professionals, the people that are providing the services. I think that is going to come in handy in trying to bridge the gap between the demand of the services and the delivery of the services. And the fact that government is trying to leverage AI, is trying to really have, recently I heard there's a center where data is now being populated from real time, from different centers, healthcare centers. That is going to help the government be able to predict what diseases are coming. So the government has put in place systems to help it predict what diseases should we be expecting, what pandemics are coming, based on the data we have from the patients. How can we avert this before it comes? So I feel like the government is moving very fast, but I hope the healthcare professionals are also moving at the same pace as the government. Because the government can have a system in place,
but if the users
are not up to speed, you're literally going to have that bit of disparity.
Imbalance.
It's going to be there. So I feel like that's something, if the government is able to create that bit of consistency, that the person using the system is empowered, the user as well is empowered in the most convenient messaging, then you're going to have results in terms of treatment outcomes, in terms of longevity. People are going to live longer because there are things that are not happening to them because you've already planned for them. And we had a breakdown during COVID. No one expected COVID to happen.
No one.
But when it came, it exposed our healthcare systems.
Yes, it showed that we cannot.
Showed exactly how vulnerable we are.
It showed that we are not able to do even anything to ourselves.
Exactly.
We are crying for to people to help us. So
I like how proactive the government is. I like how systems are put in place here. We just need to now look at the people aspect, the human intellectual resources, and the people up to the level at which the government is moving at. Because once you lose that, we are actually going to struggle.
I like that.
Yeah.
Are we at the level at which the government is moving at?
Yeah.
That is very key.
It's very important.
So just like parting words to a young entrepreneur who is coming up with a similar startup.
Yeah.
Not maybe in the same field,
Yeah.
but kind of the same startup. What would you advise a young entrepreneur now? The challenges you've gone through up to today? What is it that they should be aware of before they come into this?
Wow. So for every young entrepreneur out there, it's important that before you come up with anything, to look at its impact in the next 100 years. Because we are building an Africa where we are not building things that will serve our generation only, but for things or solutions that will echo through generations. So if what you're building is just going to buy you a house, get you a nice wife, get you a nice car, make you look good, then I think entrepreneurship is not your place. I would appreciate if there's purpose to what you're building. And the purpose is to make sure you make the lives of those you're building that solution for better than they are right now.
That's key.
That should be your motivation as an entrepreneur.
That's very key.
Otherwise, if you're looking for funding will come and you'll close business in the next 2-3 years if the funding is out. So, but if
however, the passion
is very important. It's going to be a key catalyst to making sure that you provide value that will consistently echo through generations. In Africa, we are building things that we are calling them microwave startups.
Why?
Like actually, I'll call them popcorn startups. Like you shine this year, you get funding, you're pitching here and there.
The next year you're out.
So, and it's by statistic. Majority of the startups, actually 90%, fail before reaching their first birthday. So if you're starting anything, make sure there is a strong purpose to it. That even at the time when you're bootstrapping, you have that motivation to carry on and actually build what you're building. So keep on building, but build something that is bigger than you, not something that is in the confines of what you can control. If what you're building is not bigger than you, then my brother, my sister, if you're an entrepreneur out there, it's going to be hard for you to scale.
Wow.
Let's build for purpose.
Wow, that's deep, man.
Yeah,
that's
deep. That's what I can say to the entrepreneurs.
That's deep, bro.
Yeah.
I wish they can listen to that.
Yeah.
Is there anything, I don't want you to go before you finish everything that is just maybe burning down in you.
Yeah.
But is there anything you wanted to say before we close this conversation today?
Yeah, I think just one thing. We are in the best times, especially now speaking to the Rwandans that are out there in school, Rwandans out there building things. There's a lot of hanging fruit in this country, low-hanging fruit, that it would be painful for the people out to come and take good advantage of what is available when you're all just looking on. And I still want to say that I commend the government for putting in place an environment that can support any entrepreneur to start. In other words, you can dream when you're in this country.
Wow, I like that, man.
You can dream.
That's
So don't study to get a job. Don't study to just be predictable, because I think that's the challenge we are all finding ourselves
study
in.
to invent.
Study to allow yourself to evolve. Because what we study, and I think that's the challenge we're having, we study and we think that what we've studied will define us. Like I told you, I started off as a pharmacist and now I'm a marketer, because I'm allowing myself to evolve. I'm allowing myself to become a better product, because that's where I can add value. Like I said, people buy you before they buy your product. So empower yourself as an entrepreneur, as a businessman, such that even when you get a customer to patronize you as a brand, they are patronizing someone who embodies the values that they share. Because culture is everything. I normally tell people culture is strategy for breakfast.
I like that.
Culture is strategy for breakfast. Everything we are building on has to be built on a certain culture.
You're right.
So if you're in business, build on culture and let it be consistent.
Wow.
Yeah.
It's been a pleasure having you, my brother.
It's been a good one. Thank you for having me,
Oh
Arafat,
my God.
at the Voices Podcast.
My people, you've heard Mr. Kagame, Stephen. He has shared all the knowledge about ECURIS. He has shared the knowledge he has about startup, about having your company growing from zero to somewhere far. And he has shared his passion for the ECURIS and transforming healthcare. Please, we beg you to listen. Watch our videos and listen and learn, because I'm telling you, without information, you have nothing. And this is where you can get information. For now, we want to leave you there, and we'll come back next time with another guest to share a voice that seeks to transform. That's the purpose we are driving here. See you next time. Bye for now.